Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. We have a fantastic program for you today, one of significant interest. And, as always, if you've had a problem, you've tried, you've applied, you come up with the same old. Not a whole lot of things that work well. Well, you're stuck. Here's an opportunity to turn the light on the subject a little differently. And you can find us here at 888-630-WMAL. That's 888-630-9625. When we're not here, you can get a hold of us at 703-698-7117 or go to our website at rosellecare.com. In studio today to discuss something that is near and dear to all of our hearts is Dr. Stephanie Pina. We're going to be talking about the heart, physical, mental, emotional, your heart on all those levels. If you ever had a problem where you felt that heart kind of flip around in your chest, or your doctor's told you got a problem, or you're in the process of trying to figure out how to fix it, well, this is an opportunity for you to understand really the intricacies, the matrix of how that little organ about the size of your fist in the center of your chest works to keep you functioning at many levels. Your heart has emotion. Your heart has physical capacity. We're going to talk about that. Dr. Stephanie, welcome to the program.
Thanks for having me back.
Listen, it's my pleasure because, if somebody has to take over from me, you're the one, you're the person. What was it? That came from the Matrix, right? You're the one? The one? Never mind.
I think so. Yeah. Just don't ask me to swallow like the blue pill or the red pill and we'll be all set.
Okay. This coming up Wednesday evening, June the 10th, you're going to be hosting a program and presenting on the heart, physical, mental, emotional at the Roselle Center for Healing in Fairfax. And what I want to do is walk through that. Patients saying the heart, emotional, the heart's mental. What does that have to do with anything? We always think of the heart as this pump that pushes blood through, and if it plugs up, we're not going to be here. But it's so much more than that. Take us through that. What is, that paradigm? That's a tremendous topic, the heart, your physical, emotional, mental heart. What does that
mean?
It's
quite something to put together, too, because there are a lot of issues that come up with it. There's a lot of pathophysiology that comes up with it. And most people, when they have to first deal with heart issues, is because they're going through something right then and there. Or they know a family member that is, has had open heart surgery or bypass, or they've had to have a talk with their doctor about their lipid levels and stuff. So everything has been really focused on the physical heart. How does it function? How's the electrical function of it? Everyone will talk about when they go in for stress EKGs to see how well their heart is functioning electronically. But there is a mental and emotional aspect of the heart that gets overlooked in our Western medicine mindset, that they're starting to be a little bit more appreciative, but essentially people have always thought in different cultures from a long time ago used to think of the heart much more as our mind, our soul, our body connection that really grounds us. So a lot of the different types of medicines that are coming out to really help heal the heart has less to do with what chemicals we put in the body as far as drugs and medication and what surgical procedures we have, but how do we try to connect back with ourselves through our heart as an organ, as the physical being and the emotional being.
So, Dr. Stephanie, is that where we're getting reports now that people have had open heart surgery, where they've actually had heart transplants, and they begin to say that they are not the same. Their families say the different personalities that are appreciated, and where somebody was very aggressive, if you will, before, now they're much more gentle. Or oppositely, if they were a very gentle, giving person, now they're very aggressive, they're angry, they're explosive. Is that the type of thing you're talking about?
Exactly. There's nothing to explain as far as what conventional medicines come out, why those people have those. Or, sometimes the funny ones are people start craving different types of tastes and foods, and they do different types of activities that they never would have done before with heart replacement surgeries as well. And obviously in those cases, there's a demand, they have a reason why they're doing the heart replacement. There's a malfunctioning organ system. But how do you explain the personality changes? How do you change somebody emotionally just by physically taking out one organ and replace it with the other? There's got to be more to it. And we know that the energetics of the heart, especially in Chinese medicine, have a lot to do with more than just pumping blood. There's many, many more functions that it essentially helps to control.
My guest in studio, your host this Wednesday evening, June the 10th at 7:30 p.m. at the Roselle Center for Healing, Dr. Stephanie Pina. She's going to be talking about your heart, physical, mental, emotional. And trust me, many of you have had problems. You've gone to the doctor. You've had different types of procedures done, and you've noticed that you've changed a little bit, and you wonder if it's all in your head. Well, it is all in your emotions, and we want to try to put a light on that. And your emotions can cause heart problems as well as your heart can cause emotional problems, and there's other systems that are involved. This Wednesday evening, we'd like to invite you to go to our website at rosellecare.com or call us at 703-698-7117. That's 703-698-7117. Tell my staff that you'd like to attend Dr. Stephanie Pina's presentation on heart, and you're going to learn a lot and how to help yourself. This is an opportunity that we don't do too often. This is a very special event. Join us. I think you're going to be surprised at what you're going to learn. Dr. Pina, let's talk about, let's take it through the physical, mental, emotional paradigm. So let's talk about the physical piece and how, from your perception and, from Western and Eastern point of view, how does the heart become sick?
A lot of different ways. And I think when we look at it physically, aging obviously has something to do with it because it's a muscle, it's a tissue that's working extremely hard. We don't want it to stop working, so that functionability is definitely in our best interest to keep it going. But we know that there are a lot of components and pieces that work with the heart. The heart itself has its own nervous system, intrinsic nervous system, its neurons. It's actually more active than the brain is. So a lot of times when we think of it, the heart is trying to control itself from a physiological standpoint and then communicate with the rest of the body. We know that there are valves, and people will hear about getting valve replacement, mitral valve prolapse, regurgitation, where the blood flow is not going as smoothly as it can be. It's not going from one chamber to the heart to the other and around the rest of the body. So there's a lot of mechanisms that are going on that are very intricate that need to be addressed and examined. And, something goes wrong with the electrical system, next thing you know, you have arrhythmias, you have murmurs, you have different heartbeats and stuff, and people will feel that. You start to feel that, and most people become panicky when they really start to feel chest pain. They start to notice that something's just not right, or they even get things like fatigue that's just not going away.
Is pain always an indicator of pathology when it comes to the heart?
Not necessarily. And I think the more you learn about, and more information you learn about, especially women's heart medicine, is you see that more and more is that women tend to be protective from a lot of heart disease until they become postmenopausal, and there's probably a hormone protection related to that. Because
we know that estrogen is cardiovascular protective, and when estrogen levels drop, both in men and women, by the way, that we have more of a problem with heart disease. Also, when testosterone levels drop down, both men and women, we have, and they seem to do that at the same period of life, the menopausal, when you stop menses and you go into as many women say, a normal life. In this country, unfortunately, we go through a transition that most other countries don't go through. But guys do the same thing. They go through, and we've talked about it many times, is andropause, and they lose their hormone function and capacity and the like. But we don't put the finger at guys. We just do it at women. Let's talk about that just a little bit further. So we have this transition, and suddenly we have heart damage. We have heart vessels that are clogging up and so forth. Here's a question, and based on what I asked you before, is pain always indicative of a heart pathology? Women will say more so than guys, you broke my heart. And they actually feel the pain within their chest. And how does that relate to what we're talking about? That deep, agonizing pain, that sorrow, that they feel like something's broken.
See, it's interesting you bring that up because as we're even talking about the physiological heart, we always go back to the emotional one without us even realizing that we're doing it. So that pain that we're feeling is the emotional pain of things. It's not sometimes the physical pain. And granted, remember, pain sometimes is also a sign that something's going on in the body. It makes us like a red flag. We want to actually do something about it. So when we're talking about the emotional side, and literally there's something called broken heart syndrome that you'll see after either a loved one passes or there's a grieving period where people will start complaining of chest pains and fatigue and all these issues that are coming out of nowhere, and they may not be able to actually find anything physically wrong with the heart, but they feel it. So it always ends up seeming to go back to that mental, emotional aspect of it, even though there may or may not be a physical condition that you can even measure.
That type of pain, though, that emotional heartbreak, if you will, left unattended and unresolved, does end up producing pathology.
Absolutely. They've seen studies that people who are going through depression have an increased risk of different types of heart diseases, including cardiovascular disease, like having a heart attack, like having high blood pressure and low blood pressure, strokes. They're higher when there's that mental emotional aspect of it as well too. And they can get a cardiac visit and go to a cardiologist, and there's nothing physically going wrong with the heart outside of the norms, and they still can't explain what's going on. So there's always the emotional aspect of it, even with the physical. I mean, we might, have Valentine's Day and joke around and have all these heart pictures and stuff, and we all know that that's not what the physical heart looks like. But we connect with it. There's a connection there, and that's what's getting overrun and not looked at in a lot of physiological
There's so
issues.
much literature out there that points to, all the things that we're talking about, the emotional stages of people. When we talked about when people get a heart transplant, that they will produce different emotional representations that are not theirs. They're not characteristics of their genetic pattern up until that point, that it seems to be somebody else that's inherited that body. And we know that the heart and every other organ system, as you know, has an emotion, but the heart specifically. So if we wanted to talk about the heart emotion, what would that be? Is it, Dr. Stephanie, I seem to be, so upset, and how would you begin to identify that it's the heart and not something else?
Well, what's interesting in Chinese medicine is that there are 5 main organ systems. There's a 6th one if you think about it, which happens to be the pericardium, which we know is part of the heart as well. That's the outside layer of the heart, but it's its own organ system in Chinese medicine, and it's the heart's protector. And there are 5 emotions that go along with those 5 organ systems. And in Chinese medicine, the heart's emotion is actually joy. But a lot of times you'll see joy and bitterness, or kind of almost a manic behavior, where it's not a bad thing to have that. You don't want too much joy in your life, but it's almost that control to kind of keep things within balance. So a lot of times we think about when we get really excited about things, our heartbeat starts to beat up. We get passionate, we get emotional, like we get fluttering. But then again, when we get really sad, it can go the other direction too. We feel depressed, our energy is low. So that joy has multiple levels and stuff. And when we look at what different people experience emotionally, it can have a lot to do with how we feel, not only in our chest, where the physical heart is, but the rest of the body too. And that's the heart communicating, just like it does to the vascular system to move blood around the body.
The heart is this amazing organ system, and literature will say it's the soul, it's the life force, it's who we are, it's our representation, as we've alluded to up until now. The heart, pathologically, from a Western point of view, is the thing that we worry the most about. And in my opinion, it's something that we need to worry about, but we need to worry about the things that affect it. And emotional stress is one of those things. You talked about the heart, the emotion being joy, but the opposite is sadness. It's if somebody's always down and depressed and sad, it will affect the heart. It'll affect the circulatory pattern. It'll affect the way the heart beats. It'll affect the energetics of the heart. When we come up into the next portion of the program, I want to take that and dissect it a little bit more. I want to look at the organ system that's called the second heart, if you will, and its representation, and why that has an effect and a profound effect on the body. This Wednesday evening, the 10th of June, Dr. Stephanie Pina will be your host, your presenter at the Roselle Center for Healing. All you need to do to attend that class is call us at 703-698-7117. That's 703-698-7117. Tell my staff that you'd like to attend. Don't go away. You're listening to Dr. Tom Roselle Live. We'll be right back.
Dr. Tom Roselle Live continues now on WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live in studio. We have a very special topic today and a very special guest, Dr. Stephanie Pina. We're talking about your heart, physical, mental, and emotional. We talk about the heart relative to cardiovascular disease and so forth, but there are other pieces of the heart that go untouched. They're appreciated as a kind of, oh, really, that's interesting, but we don't really understand in traditional medical circles what the impact is. From an Eastern point of view, there's a tremendous amount of understanding and has been there for thousands of years. This Wednesday evening, June the 10th, Dr. Stephanie Pina will be your host, your presenter at the Roselle Center for Healing in Fairfax. Love to have you as our guest. If you have any kind of heart issue, this is a program that you really don't want to miss. If you've been brokenhearted, if you're in a place where your heart hurts all the time, so to speak, Call us, 703-698-7117. That's 703-698-7117. Dr. Stephanie, let's get into that pattern of, things causing other things to happen within the body. And we know that there are organ systems that are connected to each other. And this is one that, like any other organ system, has its paired. We have, as we've talked about, the lung and the large intestine over a period of time. People who have lung problems don't necessarily manifest with lung problems. They show intestinal tract, large intestine. This is another one of those linkages. So, small intestine, the upper portion of digestion, has a huge impact on the heart. How do we understand that from a Western point of view?
Well, what's interesting is a lot of times when we end up talking about the intestinal tract and digestive issues, we talk about how it also has its own internal nervous system, basically, right? We know that it functions. So the heart has a similar type of system as well, too. They're very similar. A lot of the times the nutrients that we need to absorb in the small intestine are going to affect the heart and the way it functions on a minute pattern, whether it be electrolyte patterns with the calcium and magnesium, whether it also be if there's inflammation factors and oxidation going on in the digestive tract from poor diets or lack of exercise. The small intestine connection with the heart also has a lot to do with where the meridians are on the arm as well, too, because that's where they are. And when you look at what the heart has a connection with the digestive tract, we don't put the two of them together, but I always thought it was interesting that a lot of times when people go in complaining of chest disease and they go into the ER and they're thinking, oh my God, I'm having a heart attack, one of the first things they end up ruling out too is also whether or not they're having heartburn.
Well, when we're talking about, just for clarification for our listeners, when we talk about meridians, what you're talking about is the acupuncture channels that travel from one place to the other. And when we're talking about the heart, it starts on the arm. And when we're talking about small intestine, it also starts on the arm.
Correct.
And so they're a coupled system, what we call positive, negative, or yin and yang.
Yep. And we also know from a neurological standpoint that the vagus nerve is basically going to the heart to help control heartbeat, heart rhythm, and also goes to the digestive tract and portions of it to help control how well we are processing food, how quickly we are dumping food from the stomach to the large intestine tract and the transit of food through the intestinal system as well.
Now, the heart has three electrical systems. It has the vagus, as you talked about, which is one of the cranial nerves, actually the longest nerve in the body. It comes down and it touches the lungs, but also the heart and other organ systems. And then it has the pacemaker, the actual internal electrical system within the heart. And then it also has nerves that come from between the upper portion of the spine, where your ribs come off, and those are called parasympathetic, but technically they're splanchnic nerves, and they cause the heart to be able to function. So the heart has these fail-safes that are all built in, and that electrical system has to be maximized. But as you said, the small intestine provides a source of support, if you will, nutrition for the heart, the minerals that the heart needs to keep in balance, potassium, magnesium, and so forth. But if we mess up that intestinal function by drugs, by suppressing digestive enzymes, by irritating that system in some way, then it can no longer be supportive. And because it's paired organ, it also has the same emotions, doesn't it?
Mm-hmm. Absolutely. So what's also interesting, you bring up the lungs too, is that in Chinese medicine, the lung and the heart are both in the upper chest. They call it the upper jiao. So they actually have a good connection. And the lungs in Chinese medicine are the immune system. It governs what's going on there. So the heart in itself also can have a lot to do with what's going on with immune function. If we're not having enough blood flow and blood supply to the rest of the body, we know that we can't get white blood cells around. The immune system's not going to be as good as it possibly can. So there are connections between the lungs, the immune system, the heart, and also we know that respiratory issues and getting oxygen around through the blood flow is dependent on the heart too, moving that blood around.
You know, it's amazing to me when we talk about an organ system that we consider so vital in Western medicine that there's so many things that we don't appreciate about it, that there are the subtleties of one system acting on the other. You know, we've said stress kills, and we talked about it earlier because of that emotional sling and arrow, if you will, relative to, you know, its effect and its dampening on that cardiovascular function. We end up with plaquing because stress causes in Western medicine inflammation. And when we have an inflammatory response, we plug things up because the body tries to survive by putting fats in it and that sort of thing. It's an ongoing process of understanding. As we go into the next portion of the program, I want to get detailed as how all these feedback loops work in the system, particularly from an energetic and emotional. I want to pick at that emotional piece because we know that there's a lot of guys coming back from war with PTSD and so forth, and it's critical that we understand that as a society, that to support these people is critical. We're coming up to a break. We have to pay attention to people who bring you Dr. Tom Roselle Live. This is Dr. Tom Roselle. Don't go away. We'll be right back.
This is Dr. Tom Roselle Live on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. My guest in studio, Dr. Stephanie Pina, who will be your host this Wednesday evening, June 10th. Going to talk about your heart, physical, mental, and emotional. It's a phenomenal subject because it's not what you think. We're going to talk about pathology, but we're also going to talk about the things that cause it, from your emotions and the way you run your brain, how you think about things. All of those have a tremendous impact, but also importantly that you need to understand the interrelationship of different organ systems and how they affect that heart, that pump, that ability of you to stay alive. Your heart is your soul, so to speak. It is the spirit that runs you. And if you don't have your heart, and many people have had heart transplants, sometimes you turn up with different personalities. You seem to have a ghost that walks in. Dr. Stephanie, let's continue the process. This is a fascinating subject. It's actually one that I could talk about for quite some time. We talk about the energetics from Chinese medicine, that each organ system has these channels, if you will, that carry energy to different systems, and they bind each other one to the other. There's controlling systems within the body, and there's systems that we call supportive systems, if you will. So let's talk about that a little bit from a mental, emotional platform. What systems control the heart? How would you talk about it? If somebody said to you, I've got a heart problem, nobody can figure out what it's all about, and then you begin to diagnose their capacity on an emotional, spiritual level, what would you talk about?
Well, obviously you want to see really what their particulars are, because I think, unfortunately, when we go into conventional medicine, doctors with issues on the heart, it's very cut and dry. It's a lot of testing. It's a lot of what's going on with the electrical part, what's going on with the physio part, what's going on with the blood flow. So when we look at it from a Chinese medicine standpoint, or even just a holistic medicine standpoint, we want to see, like you're saying, how the rest of the body affects it. And we can't really stress the fact that stress has a lot to do with what's going on. And in Chinese medicine, the liver tends to be what I always call it and tell my patients is the emotional and the chemical detoxifier of the body. How do we deal with what's coming in, whether it's food, medications, pollution, you name it, but how do we deal with what's going on internally, and how do we process it mentally, and how do we respond back? And when we don't respond back to stress and we tend to hold things in and we tend to not even know how to deal with those things, that can affect the heart, because like we were talking about, depression, over-anxiety, frustrations, anger, which is the emotion that goes with the liver. When anger tends to take over the heart, we start seeing physiological symptoms, because our brain and our sympathetic nervous system, our fight-flight system, is ready to kick in going, this must be a real thing that's going on.
Well, we know that the liver controls heart energy. And unfortunately, in my family, in my life, there was a very dramatic representation of that. My mother died in her... I think she was 76 when she passed away, and she had pneumonia, and I had gone back to treat her, and I told her, I said, if you don't get better within, a few days, make sure you go see somebody. But apparently she gotten better. But, these old Sicilian women, they used to treat their colds, their chest colds and pneumonias and so forth differently. So she passed away 6 days later. She'd been out and about apparently, but they found her sitting in the living room, reading a book with her glasses on top of her head, so she went to sleep. But they also found sitting next to her a cup of coffee, and in the coffee was whiskey, but next to that was a bottle of cold Tylenol. And so what had happened is it shut the liver down, and then because the liver but weakened dramatically and became very toxic because of those things, it then shut the heart down, and she went to sleep. That's the type of thing we're talking about.
Exactly. And when you think about, when I look at the heart and heart disease, I'm not also ruling out the large blood vessels, the small blood vessels, the circulatory system, because the heart puts out stuff, right? It puts out blood flow, so it has to go there. And it's very interesting when we're bringing up the liver and the heart, because they have their own special connection. The hepatic portal system, where blood flow goes back and forth between the two of them, it's like they have their own little chit-chat going on, basically.
They have their own little inner circle.
They do. And so the heart's willing to let the liver in, but then again, the liver's, emotionally ready to beat up on the heart. Go figure. But when you look at it, anything that affects the liver can affect the heart. Anything that affects the lung can affect the heart. So these other organ systems really have a lot of control, even though we always think this heart is this, big, strong muscle. It's got its own type of connective tissue that's in there. But really, it's relying on the other organ systems to function. There is an interdynamic between the two of them. And unfortunately, when you go to visit the cardiologist, they're not looking at the other organ systems other than what are, side effects of cardiology diseases. So.
We talk about energetic systems from Western to Eastern medicine. And there's this, in Eastern medicine, we call Shen, which is, the constitution. And in Western medicine, we call it Shen, constitution, the vibrancy, the strength, if you will, of that person. And the translation, when we look at the heart, they both have an effect on something called these little organ systems called the mitochondria. They're the energy packs. They're the powerhouses. They're the drivers. And any time that you beat up the mitochondrial pack, what happens is the heart will go into failure, or it won't be able to rectify its metabolism the way it needs to be balanced. So here you have this stress pattern, this anger pattern, if you will, or even people who are fearful, that will also have an effect in dampening the heart. It seems like all roads lead to Rome, so to speak. But if we have that in balance, the thing that suffers is these little energy packs, the mitochondria, that have to do both with what we call constitution and also Shen in Eastern medicine. How do you look at that? How would you explain that? I'm kind of tiptoeing around it. I know where I want to go with it, but I'm more curious of what you have to say.
Oh, it's the mind reading of the results.
Yeah.
I love when this happens.
I know.
So what's interesting about Shen when you bring this up, but in case it's kind of a weird concept for some people to think of, just like when we always talk about the energetics and acupuncture systems as well. But the Shen can also be that energy that you see, it reflects into someone's face. It reflects into their eyes. When you look at somebody and you can say they're there, they're present, it can reflect into what they're doing, how well they're doing things as well too. So their vibrancy can be not only their look and how they're acting and feeling, but it's their overall being. And that's also where the emotional side starts to come in for the heart. So when we look at, and now I'm off topic.
But it's okay. You're going in the right direction. I'll pull you back in.
The heart and the Shen are connected.
We'll get it back in.
That's where I was going. But when you look at when the heart is talked about in Chinese medicine, what's interesting is it also helps to govern other functions that have to do with the person's vitality and how their Shen is functioning. And when you look at it, it can affect their mental mind ability, their sleeping ability. Essentially, it affects their circulation through the rest of the body, but it also can affect their hormone process because the blood flow needs to get hormones to the target tissues that need to go to function. So when you look at a person's vitality and whether they're stressed or they're emotionally unbalanced, you can see how they all interconnect together.
See, it's still all about the heart.
Of course.
So you didn't get too far off topic. It was right there.
I said heart. I said Shen.
Yes, you did.
I said blood.
Not a problem. So no, but the heart is about all those things, and that was the reason I brought that up. If the heart is being overburdened, then the personality, the Shen, can be beat up as well. The strength, the constitution of that person can beat up as well because of that emotional things. I wanted to talk about the guys coming back from overseas and, they're suffering from PTSD and so forth. We know that there's a kidney fight-flight adrenal pattern that's associated with that, but I want to talk about the heart itself because there's been a lot of study that has gone into, let's see what we can do with that emotional heartbreak of being over there, the things that they saw that hurt them so deeply that they can't get it out of their system. Talk about that a little bit.
Well, what's interesting is they've monitored responses, and there's a number of different studies on this, where they've looked at respiratory rate, they've looked at heart rate, they've also looked at, they've done questionnaires to talk about the physical and the emotional side as well, too. But especially heart rate, what they've done is when they have soldiers or people who are suffering from PTSD come back, or they actually put them under kind of a pseudo-traumatic experience, so they're stressing the system, what they're seeing is that there's more irregularity in their heartbeat, there's more irregularity in their breathing patterns when they are under those moments. And when they see that, that's when they start to feel those other physical symptoms. They might get tightness in their shoulders, they might get headaches, they might have their focus disappears. So their body goes into that fight-flight system. They're constantly there. They're in the moment. And unfortunately for some people who are coming back from, war situations and stuff, they're there. They're re-experiencing the whole thing. What the studies have shown is, and a way to help people, is that if they can regulate not only their respiratory rate but their heart rhythms so that they can decrease them and use things like deep breathing, which again goes back to the connection of the heart and the lungs, they were actually able to regulate their heart rate better, and that stress and mental, emotional system was able to decrease so they could feel more at ease. So they were able to actually kind of bring themselves back. And this is stuff they were able to do on their own. They were able to train people to do this. Things like acupuncture, meditative techniques, other types of stress-related techniques, biofeedback, are all things that have been incorporated in different measures with trying to get the sympathetic system, that flight system that everyone's stuck in, to decrease. And then it can kind of help them also move through some of the aspect they're having. But the main thing is that it's using a physiological response like abnormal heartbeats to work on the emotional side.
But it breaks down that piece that you were talking about earlier. The heart is supposed to be happy, joyful. It's supposed to be expressive. It's supposed to be loving and giving and binding. But what happens with that, it gets beat up. Mm-hmm. And pretty soon it expresses itself as sadness and deep depression and Taoism and so forth. And there's techniques that can begin to pull that out. Our friend Dr. Steve Zodkoy out of New Jersey is doing a tremendous amount of work with the United States Marine Corps when it comes to PTSD patients. And one of the techniques that he uses that we all use in our practice is NET, neuroemotional technique, or even emotional freedom technique. There are many different forms that can be applied, and the patient can be taught to help themselves. And you see major resolutions of these folks, but it all has to do with what you're talking about, that whole heart electrical energetic pathway. And when it says that our heart is affected by our environment, you can suppress the heart, you can embolden the heart. All those things are true.
Well, one of the cool things that I had last September, I had a chance to work with a couple from Belgium that came over to speak to a group of acupuncturists, and they called it the cardio acupuncture pathway, which when you talk about acupuncture, a lot of times it's talking about pain and stress release and stuff, but a lot of times they don't address the heart this way. So what was cool about them is they had a clinic that basically just saw cardiac patients. He was a cardiologist and an acupuncturist, and she was a physiotherapist and an acupuncturist, and so they were teaching acupuncturists how to deal with serious cardiac issues and getting results. And one of the things that they kept mentioning, because they were treating on both aspects of it, they're treating the western and the eastern side, is that they had to keep putting emphasis on treating the Shen, on treating the mind and the spirit, because the physiological part didn't respond as well unless they treated the emotional part. And that patients that were going through surgeries, Western medicine procedures, often when they came out, they didn't respond as well if they didn't have the right mindset. So if patients had to go into a procedure, which they referred to, they were able to put them in a better place so that they knew that their healing processes were going to be better afterwards. They were able to affect the energetic side of the heart as well through acupuncture. And they didn't do any herbs because of their restrictions in Europe. But what was interesting is they did do diet and lifestyle issues. And other than the fact that when most people have major cardiac issues and surgeries and it becomes a life-changing event, they're a little bit more willing to make those changes that they might not have wanted to make before because they saw the result of what might happen if they don't make those changes. But at the same time, when we talk a lot of times about that being like diet and lifestyle and exercising more, that also means they have to look back at their lives and realize, is it worth being stressed out over, say, a job situation, over family situations? That's the emotional side being addressed too. So we'd like to get to patients where you're thinking about this preventatively instead of having to wait till after a major
it's never
heart issue to have to go back and treat this.
That's right. It's never a good thing to get the horse after it's out of the corral.
Correct.
You got to bring him back in. It's a whole lot easier to keep him happy,
Right.
when he's sitting there. And that's, particularly when it comes to the heart and lifestyle and so forth. We teach patients how to take care of themselves, to embrace themselves, to realize that they have control of virtually everything that happens to them with few modifications. I mean, even genetics, we know today that 80% of all pass-throughs, all gene genetics, or runs in my family type of thing, can be altered. You don't have to express that pathology. But it also has to do particularly with the heart. Well, my father had a heart attack. He died at a young age. And my grandfather, so forth. Well, you have to look, is it really genetic or is it lifestyle? Is it the way you run your head, how you think? If you grew up in a family that is angry all the time and explosive and they hold it inside and they bury it in their back pocket, you're going to eat that heart up, if you will, so to speak, and you're going to suffer the slings and arrows of heart disease, and particularly with arrhythmic problems, which we see all the time, the heart begins to misfire, and it comes out of nowhere. And so, do you ever have a problem like this before? Patient says no. And, well, where did it come from? I don't know. My doctor said it just happens. Things don't just happen. You have to look at the emotional piece as well, and you have to teach them how to control that and keep the horse in the corral, if you will, before it ever thinks about getting out. We're coming up to a break, and when we come back after the break, what I'd like to do is get into a couple things that you're going to touch upon on the program this Wednesday evening. Dr. Stephanie Pina will be your host and presenter at the Roselle Center for Healing this Wednesday, June the 10th. We'd love to have you as our guest. All you have to do is go to 703-698-7117, 703-698-7117. Tell my staff you want to be there. There's absolutely no charge. It's our gift to you. Don't go away. We'll be right back.
Dr. Tom Roselle Live continues now on WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. My guest in studio has been Dr. Stephanie Pina, who will be your host, your presenter this Wednesday evening, June the 10th at 7:30 p.m. at the Roselle Center for Healing. Love to have you as our guest. What you going to talk about? Your heart, your physical, your mental, your emotional heart, all the things that play into that organ system staying healthy, but when they're not present, then you end up with pathology, all the things that we talk about in Western medicine. But more importantly, you have to combine knowledge. You have to understand what to do with it. If you're on medications, if you're on things like Tropolol to keep your heart in a normal rhythm, if you're taking, blood pressure medication because your doctor's afraid that you're going to end up with a heart attack, or if you're taking blood thinners, this is an important program for you. This is one that you can find out how to make a huge difference and turn things around, maybe forever, without any interference of medications that you're on right now that actually will take your life. And we know what the side effects of a lot of the statins are and the blood thinners and so forth. They're awful. They're worse than the disease in most cases. Give us a call at 703-698-7117, 703-698-7117. Dr. Stephanie, let's talk a little bit about, what we're going to be doing on Wednesday evening and how you're going to help people.
We're going to talk about the heart the way most people have not talked about the heart before. And the focus of this is to understand how you can help yourself by understanding what's going on with the body better, and then the heart and the cardiovascular system in particular. How does it function? Do we understand what the heart's made of first from the physiological standpoint? Do we understand the electronic standpoint as far as how does it communicate with other organ systems? How does it communicate with the brain? How do we use feedback mechanisms and loops to basically help control the function of the heart rate, rhythm, and then we're going to get into the emotional aspects of it. How have people been seeing changes in results when they've changed their emotional side? Not just decreasing stress to help prevent heart disease or changing diet to help, boost CoQ10 levels, but essentially what we're trying to do is treat the emotional side of the heart that gets ignored. A lot of times we talk about wearing your heart on your sleeve and how that can almost be, we talk about someone being emotional then, and that could be a good thing or a bad thing, but how do we embrace always wearing our heart on our sleeve, whether we're passionate about something or angry about something, and how does that have a physiological effect on the body that is lasting more than just when we're thinking about that one particular thing. So we're going to go over a lot of different things, and then we're going to bring in some of the Western medicine science and how they kind of work together, but you got to know and be more familiar about when you go to the heart doctor, how you can help yourself at the same time.
It's an amazing program. It's an amazing topic. It's one that we all need to be well versed on, because the truth of it is that your health is in your hands. It's incumbent upon you to really understand what you can do to help yourself and not put it on the table for somebody else to direct you. The more information that you have, as we said forever, we've done our job here on Dr. Tom Roselle Live the right way. What we've done is we provoked you to do your own investigation. Don't believe anybody, including me. What I want to do is make sure that you question everything. You question the medications. You question the lifestyle. You question the fact that maybe you should be doing something a little differently than what you're doing right now. But this Wednesday evening, you're going to have an opportunity to get more data, more information, more understanding, but more importantly, how you can actually fix things that you've been putting up with for way too many years. Dr. Stephanie is an expert in this area. She's somebody who has a tremendous amount of knowledge. She's a doctor of naturopathic medicine. She has the capacity to be able to pinpoint things and to show you how to pinpoint them for yourself. That's why we're here. That's why we do Dr. Tom Roselle Live. We're here every Sunday at 12 o'clock, right at the dial that you're listening to right now. Make sure you tell your friends that we're here to serve. We'll see you next week, same time, same place. This is Dr. Tom Roselle. Bye.